My name is Shelby Moe, and today I'm doing the dissection of a sheep kidney. So to start with, I already have it cut in half here. So I'm just going to go down the glossary here. We have calyx, which is divided into minor and major calyces. So the major is found right here, and the minor is over here, kind of down near the end of the renal veins and arteries. The hilus is right here. It's kind of that little depression where the renal vein and arteries enter the kidney, and where the ureter exits. So it's that little depression right in here. The renal artery and the renal vein are right here. And those carry the blood. And then the ureter is also right here, kind of on the bottom portion of this. The renal capsule is the connective tissue on the outside here that protects the kidney, and it helps it to maintain its shape. So it's actually just a thin little layer on the outside of the kidney. Goes all the way around, so it's also on this portion. The renal corpuscle is where the filtration occurs in the kidney. The cortex is kind of the outer region of the kidney here. You can see a slight differentiation in color there. The renal lobe is a portion of the cortex at the base. The renal medulla is the inner portion of the kidney, so that's going to be in here where the pyramids are. The renal papilla is the apex of a renal pyramid, and it's continuous with the minor calyx, so it's going to be down here. Pyramids right in this area. The renal pelvis is a large cavity that receives urine, so that's going to be down here, connects with the ureter, and it receives urine from the major calyces, and it's continuous with the ureter here. The renal pyramid are cone-shaped structural units. So those they're kind of hard to see on here, but you can kind of see them. They're right in there. Just slightly different color, and you can differentiate them, especially if you use the probe. Can see the different units there. And then we already went over the ureter and the renal vein that exit. And those are, of course, in that depression in the hilus. And that is the sheep kidney. So put together as one piece, it is like that. And those are the two halves that I worked with for my dissection and to determine the different parts of the anatomy. Thank you.